everybody. I want to welcome everyone to Tales from the Trails. I've got Alex here with me. Alex, thank you so much for joining us today.
Thank you so much for having me.
If you don't mind telling the audience what company you work for and what your role is in that company.
My name is Alex Waddell. I'm the Chief Information Officer at Adobe Population Health. We're a population healthcare company that partners with Medicare and Medicaid plans to serve underserved members in our communities. We service the Southwest. We're currently in 3 states, and we just try to provide resources and much needed care. We don't really do hands-on work. We're not a home health organization. We're not a surgery center, anything like that. We just go into the home and contact the members and help them navigate the complex healthcare system.
Awesome. So what states are you guys currently serving right now?
We're currently in Arizona, Nevada, and New Mexico, and we're constantly growing and looking to expand into multiple states this year and beyond.
Okay, great. So you kind of mentioned that you guys don't do a hands-on approach, but you'll go into the homes and just assist with any needs. So are you guys basically like case managers, or explain a little bit more of your role?
Yeah, absolutely. So Adobe Population Health, as I said, we partner with Medicare and Medicaid plans, and what they generally do is give us a population of members that are utilizing the hospitals very heavily. They're not going to see their doctors, and so therefore the healthcare costs rise very rapidly. When something goes wrong, they think emergency room immediately. So what we do is we stand in between them and their providers and the healthcare system in their area and help them navigate. So instead of going to the hospital, we remind them, hey, did you drink any water? We also provide much needed support on gap closure. So these are like cancer preventative screenings, blood pressure monitoring, things that if we don't keep a close eye on them can grow into bigger problems. And we know that the primary care physicians only see the member when they show up and when they decide to schedule. So we provide a very much needed, like boots on the ground kind of support to the members. And again, yes, we just help them navigate the healthcare space, providing them with resources. We really believe in tackling what are called social determinants of health. And these are the socioeconomic issues that face our families and our members every single day. Things like not having enough food, not having transportation to go to your doctor's visits, not being able to read. These are barriers that get in the way of care. And if we don't help support them, then the members are left on their own. So we provide them with food banks and translators, and we help them understand their medications. And we believe that if we provide that much needed socioeconomic support, that we can reduce overall healthcare costs by improving the quality of life. And that's our mission here at Adobe.
That's great. I love that. So I know that there isn't one way that you guys really address. Each member is really individual. And I know that we had talked previously, and you guys pretty much do whatever you can to help. Do you want to tell us some of those stories about some of the things that you guys have had to do for some of your members?
Absolutely, yeah. So every home that we walk into is a completely different situation. As you said, we don't have a one size fits all for case management, which is really a differentiator between Adobe Population Health and some of our competitors and people in the industry. We've seen all types of things. And some of the funny stories or fun stories that I like to tell are, for example, one woman, we contacted her on the phone to complete some gap closures. And she said, I'd love to have you out, but I'm afraid to leave my house because there's a bobcat living underneath my house. If you can't fix that problem, then don't bother showing up. And we're not animal control. We don't really know what to do with a bobcat living underneath your mobile home. But we do know how to contact people. We just start making phone calls. We just contact animal control. We contact whoever we need. We got the bobcat out, and she's been on case management for years. Another family were having septic tank problems. Again, we don't manage septic tanks. I don't ask my nurses to go out there and empty septic tanks, but we know how to find the resources that can. And usually we find grants. A lot of this has to do with people not having the financial ability to pay for these types of things. So your septic tank just goes unserviced. Maybe they're in such a rural area that they just don't even know how to schedule a routine empty. So we set that up for that member and their family, and they've been on service with us forever. One last story is kind of a weird one, but we had somebody who was living on the streets and was just really down on their luck. And so we wanted to get them into a shelter, but the shelter couldn't receive them for a week. So our CEO busted out her credit card and paid for the hotel herself. Not that she even needed to, but because we have a lot of cards out there, but we're just the type of people that just do whatever it takes in the moment to get it done. No bureaucracy slowing us down. We just do what we need to do. Yeah, those are some of the stories, and it's just incredible work that we have the privilege to do.
Yeah, I love that. I love all of the different things that you guys come into. And one of the great things that I love about your company is that you guys aren't just virtual. You guys are going into homes. You're taking that really hands-on approach. And I really love that. So this kind of moves into our thesis. So we believe that every business and organization, they have a mission statement that they're trying to deliver. Can you guys tell us what your mission statement is?
Yeah, our mission statement has always been to positively impact the lives we touch. And so that's, of course, for our memberships. And to call back to what we were talking about earlier, just solving those socioeconomic issues. We believe that if we solve those problems and improve quality of life, that not only does the member get healthier, but we also can reduce the overall healthcare costs for the population. But also, we believe in impacting every single person. Every life we touch is our employees, every vendor that we work with. That's really our philosophy. And we try to embed that into every employee that works for the company.
Okay, Alex, what made you get started with this company? Did you always have like a health background or how'd you get
No,
started?
yes, it's a bit of luck or who you know. So I started with a company called Beach Medical Group out of college. I wasn't always thinking of getting into healthcare, but an opportunity presented itself with that company. And over time, that company sold, and Jamie Ambrose, our current CEO, purchased the case management contract. And I continued on through and carried on the mission of positively impacting each of our members. I've just been along for the ride.